All right, we are back with a very special K-Pan today. We are joined by Gloucester Mayor Sefatia Romeo Theken. It has been nearly 1 year now since COVID entered our lives and really affected us here in the city of Gloucester. So, Madam Mayor, we just want your reflections on what the past year, how has it affected the city? Yeah.
Reflections. It's brought a lot of changes that we had to make as we were going day by day. It didn't, the pandemic, we didn't know. When we said, you know what, we had our first meeting, it was in February. Carol and I met in the beginning of February saying, this is happening and what's going on, and we're moving and we're looking at, it's not even hitting Massachusetts yet. What's happening? What is this, pandemic? What is this virus? You're hearing it's happening all over, other countries. And so, we're getting prepared, and we met back then, with Dr. Sapphire, and we met with some of the local social agencies, and then all the nursing homes, because, it's hitting, our seniors. And she was really proactive on that and really getting that. And we actually had our meetings, you could see face to face. We had like the little council room, what are we going to do? And we wanted to make sure that Rockport didn't feel they were alone, especially with Denmark, because it's our backyard. We have, you have to go right through Gloucester in order to leave. So we figured we worked all the logistics, okay? And when are we supposed to close school? How are we going to do that? What's going to happen? It was each step by step. And, people were getting in as we get closer, people were so afraid, like, what are you doing? How can you not doing that? And we had to make sure that, first of all, everything was in place. They didn't understand that there's so much to put in place. And working in the healthcare, it really frightened me that, you can't just leave, people who are homeless in the streets. You can't leave, a person who has an addiction problem, not have a place to go if they get COVID, because you got to go through the withdrawals. It's so simple to say, okay, seniors who are by themselves, what happens if they get sick? Are they going to know? Is anyone going to be like a call mate? Anyone going to, when you live in the housing authority or you live at Central Grammar, you have someone there to, who lets you know what's going on. But you live in an apartment, and if your child, wherever it is, the East Coast, West Coast, doesn't matter. The fact is, who's going to check up on them? And we used to do that anyways. When I was in the hospital, I had like a networking. This just brought in more, and it wasn't just because of a storm or a hot day. This now we knew was going to last, but never in our whole planning system that we thought a year later we're still planning for it. And you still have to, because everyone thinks, well, there's a vaccine. Okay, no, you still have that things that we have to do, and it was hard. And then
Mayor,
you can't.
Can I ask you? Can you say what systems worked? And what systems did you say, oh, we got to change this?
Well, I really can't say what didn't really work, because like I said, it didn't come with a book. It didn't come with anything. We were taking each crisis and making sure it was no more a crisis. Make sure what was in place is, it's hard because I think we're spoiled in this little bubble we have. And I call us a bubble because, technically with the bridges we have amazing networking. We have amazing team. We're very fortunate with the Open Door and Action stepping up, and the Grace Center and, Health Project and Senior Care and Gloucester Housing Authority. You have no idea, Interfaith. You have no idea. I mean, even the museum. What do you need out there, Mayor? What can we do? How do we do this? Kids are graduating, the schools, everything. It's really wonderful being a mayor, knowing that you have this network and knowing that you've had these friends prior that you were a mayor at the hospital that's still there. So, and they know you, and then, what are we going to do and stuff, and be able to be open. It's like, oh, damn, don't worry, it will happen. Okay. All right. So we have a location. The Y was great. They stepped up. We're going to give you, the gym. Okay, so that's fine. Oh, well, that's a gym, but that's an empty space. What are you going to do? Put it in it, and hurry up and put it in there, because it's, they're in the streets. So what do you do? And the food and everything else, and everyone just, 1, 2, 3 stepping up. Okay, so we use that. Then what do we use the Action Shelter for? And what happens if someone gets COVID in there? Everything you can think of, we can think of. I mean, we were talking 3 times a week. We were doing Zoom meetings and Google Docs and all the whole thing 3 times a week. And, I think I said to Karen, who's the director of the Board of Health, I says, you know what? I never even talked to you before. And now it's like an everyday thing or a text and talking. I never even talked to you before. I
That's
knew
right.
her for years.
She's a weekly regular on this show.
Yeah,
Yeah,
you know what? I mean, and like I knew her from before she was the director. I mean, with the Shanat 13s, if anyone knows what the Shanat 13s and the Winter Region Task Force. So we are familiar with doing task force and getting things done because that's how we know who's going to do it. And I still do it with the storm now. I put everyone on there and sent it out. And who's this, this, and this. Okay, if it's a 3-day, and then you do it with my other staff. You do it in the winter. You know, with the police, the harbor master's office, the fire department. You know. Make sure, did you get those little sticks that go on the fire hydrant? Now the sewer's undone. How's, the coast doing? Now, are we gonna have flooding here? What's the wind? What's that? We get that all in the morning and then we text each other and we're fine. And with this, that, no, don't call a ban. Yes, call a ban. I mean, people think that it's all done with one person. Well, she can do it. And I mean, I'm the mayor. I guess you can blame me for everything. That's fine. But I was hoping that if anything, that when people were looking and listening to Zooms and all these boards and commissions and all these things, that they would realize that what the process is. The mayor's office is administration, city council governs it and whatever. But when it came to the pandemic, it was all upon the administration. We just had to move. And it was in emergency mode. And we, did we make errors? I'm sure we did. But to me, it's not an error. It's a lesson learned. And if you keep doing it, then it's an error. But I always say every mistake we make, if we correct it, then it's a lesson learned. And you're never too old to learn. And I'm hoping that we never ever have to go through something like this again. It was brutal. We were going through so many other different things in the country too. So it was really, separated. Where I thought that we would be united. Health has to come first. The pandemic's coming first. But yet the pandemic turned out to some people saying it's, whether it was man-made or whatever, or how it is, but not to believe that it exists and who it's going to affect. And remember, in the beginning, it wasn't school children. It was only adults who had different illnesses, but it's not. It went to healthy people, went to young children now. So it's so many different kinds. Okay, well, I understand what they're saying. It came from China. Someone had a bat, whatever. Now it's in the UK. Did the bat fly? I mean, it's like now it's in South Africa. I get that bat. That bat's traveling more than we are. And it's just crazy. And it's different mutants. And how do we do it? But the best thing is always is hygiene. You got to keep washing your hands. Whether you have the dollar store or whatever, or, Addison Gilbert Hospital, a little cleaner here, whatever, just soap and water. And, I forget, wear the mask, whatever, some kind of coverings, and it was kind of hard because yes, the mask worked. No, they're getting out yet. You know what? Listen, if everyone who doesn't believe in this just bears even something, I don't care. It's covering out of respect. I should say, what? I have asthma, I can't breathe, but out of respect for someone else, that just put it on or don't go out or do what you need to do, and it's understandable because what, I was on a lot of Zoom meetings and I was texting the best I could because some of the restaurants would say, what, I don't know what the governor's going to do. One day it's this way, one day it's that way. Can you at least let us know? And I would ask we would meet as mayors twice a week, sometimes 3 times on a Sunday. And I asked them, what, don't you people have families? That's right. Young men, your wives cook for you. That's why. The rest of us can not do it at 3 o'clock on a Sunday. And we start laughing, but because we needed a little bit of humor. Yeah. Because we're all in the same boat. Where it's hard, and they always they always count on you for a little bit of humor. And I just got off the actually a Zoom with Senator Warren. And we're all on there. We're still waiting. So and everyone's muted. They're all looking at each other. So I unmuted and went, for those of you who are not going to run this year, God bless you. And for those who are, well, God bless us, it's just that we're waiting. They said, we can depend on you because we're all looking at each other, and then she came on it. And then she had difficulty. She had to actually get off the Zoom and actually call in. And, one of the mayors said, and that's what our students, it's happening when you do remote learning. Right. That's happening. It's happened at city council meetings where people free. And I mean, can't be the rest of our lives normal. I think in the beginning it was fun. Oh, look, I see you. And we're all happy, excited that we saw each other. But now it's like, I want to be outside. I want to be able, the most thing that for an Italian person that, every time we used to walk into the house, you would kiss someone hello, cheek to cheek and hello and hug and everything. that we took for granted, and you would have the kids go, go kiss your nana, go kiss, Grampy, go whatever they do and everything. And now it's like the only gift I want is be able to hug my grandchildren, and that's like, what, we take everything for granted. And sometimes the most treasures that we don't realize is that when someone loses someone from this COVID, they couldn't say goodbye. And I just lost my cousin, and I had to console one of the sisters because she wanted to say goodbye, and they said, well, because he's being cremated, you're not allowed to because he died with COVID. She said, but I just want to hug him. And they says, you can't because he has COVID. She goes, but he's gone. She goes, but the COVID's still there. We didn't, it's trying to say, she goes, well, it's not fair. She says, I lost my husband. She says, and I couldn't say goodbye because he died instantly. I lost my son because of an accident. I want to say goodbye. And so when you listen to someone and you hear that, remember that, when you were with someone, if you were dealing with, radiation, and you always had someone with you every day, and now no one can come with you. Okay. No one can confront you, or so you're in the hospital and you want to hold someone's hand and saying it's going to be okay. While they're fighting and struggling for their lives and you can't be in there. Someone, you're dropping someone off in the emergency room and thinking they're going to come back out. And when you say we can't because they have COVID and we're going to transfer them here or there, and then they pass away. I mean, that's reality, whether you believe something or not. That person lost a life. That person lost someone in their family. That person is no longer there. It's a part of just, whether you believe in the COVID or you don't, or how they did, or while they were old. That's not true. My cousin was 58. Or they were very sick. No, he wasn't, So you don't know. And you know what? It's just a little bit of respect. And
these are some of the saddest stories about.
Yeah. And he's the number 35. And, 2 months ago, was it more than 2 months ago? I think it was in the beginning of the winter. Or even prior, I put out on Facebook, let's make a quilt. Let's do something. And Roseanne Cody, if everyone knows Roseanne, she's like my number one volunteer. The Halloween pie, everything else. Okay, boom. All right, what do you need? Then she talked to someone from the museum. Next thing you know, they have this beautiful quilt that it's almost up. But she says to me the other, do I have all the names? I gave them the names, and and then I have this, and I gave them that, and then I said, here, the context of families, because what was sad is I put the day of the inauguration, when they had all those flags, I put flags out on the mayor's page, and I put it on my personal page, and I said, here's a list of everyone that passed with COVID. It's not breaking heifer, it's public, and so someone emailed me and said, well, so-and-so didn't die with COVID. He was sick. I says, but COVID took him. And then, well, no, yes. I may have had cancer, let's say, and then I died, but I got COVID, so they couldn't finish my treatment with cancer. And that's just what's on the desk, let's say cancer, but by death by COVID. And so we just figured we don't want to leave anyone out. And so we did the quilt. The quilt's coming out beautiful. There's so many different kinds of quilts. I mean, we have some people crocheting things like my little ace. I have him right here. That's my ace. The best thing that happened right now with the community impact, because it's so much a relief. You have this little, I am going like, it's just so wonderful to have all of these things in the community to say, you know what, we acknowledge it. We acknowledge that you lost someone, whether, they had an illness, and it's nothing to be ashamed about, that if they died of COVID. There's absolutely, and that's what that remark of how that person passed. Well, yeah, I understand they were struggling all that, for the past 10 years with the cancer or whatever. But there's nothing to be ashamed of. It wasn't because, something happened. I mean, my friend, and I can mention her name, the kids allow, I mention her all the time. My friend Sarah passed away, and she was struggling with cancer. She survived the cancer and she was in remission. She wasn't feeling good, and she was staying away from everyone. And she got cancer. She got COVID, and she died. And it was hard. And the kids get upset saying, because you made it through cancer, but because your immune system, of course, it's going to affect people differently. If but it doesn't mean it's not going to affect you. And that's what I want people to learn. If anything we learned is just the respect that we need to do in the process. And
Mayor, we
you
know
know,
that you have an appointment at
yeah,
1, so we don't want to keep you too long, but we want to ask you about going forward. It looks like
well,
restaurants will
let me
get a reprieve.
see. Let me see. Yeah, it's a kickoff. What we want to do going forward is like we learned from last year. We know that Gloucester's been discovered. And last year we had 70,000 people, and you can't force them. And when you can't expect the police, people walk around, put your mask, but we're not there. We'll do the best we can. We'll promote it, where people still haven't got their vaccines. The Board of Health, she was saying that maybe we'll put like a thermometer. It's all these people are vaccinated, all these people. So they'll know that people are still not vaccinated in Gloucester. They're going to come visit. Well, you know what? We're halfway there. We're safe, but we're not 100% safe. So please, still wear your mask, still what you need to do. We need to do a lot. We're still gonna, see how we can interact with the park rangers, because we know some of the beaches when they're high tide, we still have things that we need to do. So we started earlier, because last year we didn't know. I mean, we know our beaches are going to be packed, but we didn't. No way somebody can say that what will happen is like, whoa. And we you know what? Right away, I says, I'm going to call some. Well, you can't hire this, you can't do that. That's union. That's this. You can't do that. Well, guess what? Park rangers. I don't care what, yes, but now we're going to do that. Now we already started talking a month ago. That we already had 2 meetings with all the people that we have to, like the harbor master's office, because out at sea, every day when I was talking to TJ and I'd ask him, he would say, it's like fiesta every day. But he says, like some days it's like fiesta and 4th of July combined. And go like, wow, he goes, everyone and then all these people started buying boats and renting them out at high cost, but you don't know if someone's even had boating license, boating, whatever you do, because I don't know to boat. I know you don't need a license, but something, you have to have. Yeah, I mean, I felt like when it was like something, a survival or whatever, but you know what? That's like out there. And then, we had DPW was like, wow, every park, Pavilion Beach, nobody went except the regulars, nobody went. They just didn't go. That was so packed that you couldn't find the regulars. I mean, it was just like, wow. I mean, every little nook and cranny that was private or not private, but what scared me is people were so desperate that they knocked on people's doors to ask if they can park.
Mm-hmm.
And a lot of my seniors were asked, and they were scared. First of all, what are you doing? And then, so we got to see what we can do about more, visibility, more, what's going on. And you have to understand that, the parking lots were not as full. We weren't allowed to. And so, and then one, I'd like to have residents only because, but that was useless, honestly, to say residents only, because what they did is we had parking. Oh, sure, we can go on the beach, but we couldn't control how many people there were. We didn't even know. They were walking everywhere.
Yep.
Everywhere you can think of, Ubers, cabs. I mean, I saw them parking at the drive-in. It's not our place, so we can't ticket them and tow them. They're playing a Greenbelt across the way, and they were walking. I mean, with coolers. I mean, just walking 3 miles.
Miles. Yeah.
And it didn't matter. They wanted the day at the beach.
We know you have to leave, Sefatia,
Yes.
but in the last minute or so, are you finally seeing more light than tunnel?
Absolutely. You know what? What's good is that, the restaurants that diversed is pretty cool. Still have to go in the igloo. I haven't gone in yet, but the ones that diverse and the things they did and everything else is great. And those who knew that they couldn't, it was just, it's not worth it. Shut down for a little bit to let some of the smaller places go, and some of the other places that you never would think of even trying. You're all trying. It's great. So, and it was great is that they all encouraged one another. And they all helped one another. And I'm thinking that of anything we can learn is what the restaurants community have done, because they were, I'll never forget, Zach Sayers called me on day 1. He says, I feel bad. People don't have outside. What are they going to do? Look at on Main Street, all my friends on Main Street, where are they going to go? Where's the Franklin go? So we're working on that. We really are. We're working on that. So, and well, tell Toners I have this, or this one has that, and he had this. And, so it's great. And they weren't competitive. They were actually partnering, which is kind of cool. And that's what we need to do, as all humans need to do in all the stuff we do, is remember, what, if God forbid something happened to those two, we're our bubbles. So let's respect one another. Let's see what we can do. Give me ideas of what you saw that was wrong and not. And, don't be judgmental. Don't be part of the problem. Be part of the solution. Okay. if people want to volunteer and say, you know what, I don't do anything, I don't mind, walking the beaches just to see how it is and give you a call, or walk down, Stage 4 Park, or help you down at the visitor center just to see how everything is or whatever. There's so many things that you can do for people who don't want to go to the beaches, or people who want to do different things. And, help us out. We're trying to get a trolley. And you should talk to Jill and do an interview with Jill and all of them to tell you what they want to do downtown. And that it's very important that we understand that it's still not over. There's still guidelines. People are, thinking, oh, it's gonna be fun for Fiesta. I don't know where you come from unless it changes immediately. And realistically, it's not up to me, but it's also up to the governor, and it's also up to the Fiesta committee, is because you have to fundraise, you have to do a lot of things, and a lot of planning isn't just, okay, let's have it tomorrow. You can do a barbecue on that one, but you can't do, so many things. Let's take it. Let's not ruin it. Let's not like, oh, let's all go crazy. And then they feel that all of a sudden it jumped again because not everyone had their vaccines, and then they have to shut down. We don't want to go backwards. We need to continue going forward, whether we believe that it's happening correctly or not. I'm upset on a lot of things. Mm-hmm. I'm glad that, my fire department, the nurses and all of that, but I'm sorry. And like I said it too, I don't know about other teachers. My teachers should have been vaccinated. My teachers have been in school. Okay. Now I'm not saying for everyone that's home, you're safe. But my 100, we're going to celebrate 100 days. And we already did 100 days that we are been in school. These teachers been in school. They should automatically jump. Now I know you have, and they should have been with the 75. I'm not saying take away from anyone, add. There was enough that you can go to these places and then give the vaccines to the Board of Health, not take them away from us, because my seniors know and trust my Board of Health. They got their flu shot. They trust the senior center. They can't go to Danvers or Fox or wherever, but my teachers can. So give me the vaccines that, that should be for the 75 and plus, and the two companies here through my Board of Health. We're already set up. It's already a go. It's great. It's working great. And then, open up one of those, double trees, whatever. I don't care. My teachers would have went to Gillette Stadium. They don't care. Get them there. Here they are. Here's a pass. Go straight. Go, because they've been in school, and that's not fair. And I believe me. You know me. I don't hold my tongue. I don't hold what I have to say. I've told him to. I mean, he understands and he appreciates it. But they have their committee, and for some reason, their committee and everyone else that they're doing says a different way. But I still say that, what, you're going to want all teachers in. If you're going to want them in, you have to get them vaccinated. But I was already been in there, okay, from day one. They should be, I'm sorry, they should be on the top of the list.
Well said. And thanks, Sefatia, for carving out some time for us today. We know you're on the move. We appreciate your work, and let's catch up soon.
So yeah, let's hope next year that we say it's the 2-year mark, that we're all back to normal, if we ever know what that is. But you know what? I look forward to keeping you updated. So anytime, please just let me know, and to have more. I love to talk, so that's ridiculous. You do.
We love you talking. Thank you so much.
All right. Bye-bye, everyone.
Bye-bye.
See you later.